Good morning. My name is Shadi Diab. I'm the Director of Simulation and Life Support Training in the Academy of Sciences, Riyadh. We'll talk today about the intubation skills. Later on, hopefully, we'll make more videos about more details about the intubation, like what are the drugs can be used, how we pre-ventilate the patient or pre-oxygenate the patient before ventilation, and the rapid sequence intubation. For today, we'll focus on the basic skill of intubation itself, and we will see how to prepare our equipment. Then after that, we move to the skill itself. Always, whenever we think about intubation and our patient needs intubation, we have to be ready. We have to make sure all the equipments are ready and working appropriately. So the equipment that we are going to use today, first of all, we have the mannequin that we are going to try the intubation on, and this is a mannequin can simulate medium level or a bit more difficult intubation. Then as an equipment, of course, we have to prepare the laryngoscope with different size of blades. We have ET tubes, different size as well, and we have the guide wire or the stylet that can give us a good the shape that we want for insertion. We have the lubricants, and we have the suction tubes. We have both the rigid, which is the anchor tube, and the soft suction tube as well. We have the syringe to inflate the balloon after inserting the tube. Tongue depressor in case we need to manipulate the tongue down for easy insertion. We have the stethoscope and the CO2 detector for tube confirmation after insertion. And of course, we have to be ready in case of failure intubation. We have to have a backup, so we have to go back to bag mask ventilation immediately. So that's why we have the bag mask system, and we have OPA and PA in case we need that. So let's move on to the patient side to see how we insert the tube and how we start the process from the beginning. Okay, now we are going to intubate our patient, making sure first that the Rangoscope is working properly and the light is on. Of course, it should be tested ahead of time to make sure the battery is on and everything is ready. So we selected the tube already. We will open the tube, then we have to lubricate the tube properly, especially on the area of the balloon or the cuff. So because the balloon, it might irritate the mucus or the skin inside, and it can make some obstacles. That's why lubricated. Then we have to use the guide wire or the stylet, as we call it, making sure that the tip of the stylet do not exceed the tip of the tube. Then after that, you will make the curve and the shape that we want based on the anatomy of the patient and the neck size and the difficulty of the intubation process expected. So once we are ready, now we will go for the Laryngoscope technique. So we'll go back to the tube. Just let's see the Laryngoscope technique. Laryngoscope, it will be handled in the left hand, because on the right hand we have to insert the ET tube. Either I'm left-handed or right-handed, because you can see the opening side, it's on the right side. So the tube, it can go with this slide down with this curve here. So we'll insert the Laryngoscope in the mouth from the right side little bit. Then we'll push the base of the tongue, and we'll take it in front, forward, and left side. Okay, up and left. Making sure not to hold the back of the Laryngoscope on the teeth or on the lips. So the pressure, it comes from this area, then up and left in this way. Now I can see the vocal cord inside. So once you see the vocal cord, you are ready to insert the tube. So we'll try to zoom in to see the vocal cord together. Then after that, we'll insert the tube. Okay, now we can see the vocal cord, the two white lines. These are the vocal cords. This is our target to insert the tube in between. So we are going to insert the tube now in between the vocal cords. So I think we went in. Now we are ready to remove the Rangoscope, remove the stylet, then connect to CO2 detector and bag mask device. Then while doing that, someone can help me to inflate the balloon immediately to make sure the pressure in the balloon is not loose, is enough. Then connect the back, and we start bagging to see if there is chest rise or not. So as you can see there's a chest rise. The lungs are expanding. Now it's the time to auscultate the 5 points auscultation. Then we'll check the CO2 detector after a few breaths to see if it's turned to yellow. So if the tube turns, the CO2 detector turns to yellow and there is good bilateral air entry, we are in. Now it's time to secure the tube either by tape or by commercial device that it's available already in most of the healthcare settings. So it's very important to make sure the tube is secured before moving the patient anywhere, because any movement for the patient, it can displace the tube easily and our intubation will be out again.